my name is Sarita.
And my name is Rena.
We are both past patients with Mexico Bariatric Center, and we are here to break the stigma of having weight loss surgery in Tijuana, Mexico. We will be covering all things bariatric to help you get the most out of this weight loss journey. Hello, friends.
Hi, friends. Welcome to Can You Stomach This?
Yes.
Yay.
Episode 9.
Yes, episode 9. Today we're going to be talking about myths and misconceptions.
So welcome to our podcast today.
Welcome. Yes. So, Sarita, there are a lot of myths out there, a lot of misconceptions out there. We are by far not covering all of them, just some of the ones that we see and hear the most. And so let's just dive right into that.
Okay,
so ready?
Yes.
What's one of the number one myths that we hear about?
So
bariatric?
Myth number 1, bariatric surgery is taking the easy way out of obesity / losing weight.
False news. That is not true at all.
No, this weight loss surgery, bariatric surgery, offers a real chance to end obesity.
Yeah, absolutely. And it's a tool. Surgery is a tool. It's not magic. You can't just stick it like a magic little box down inside of you and think that all of a sudden you're going to lose some weight and keep it off forever. It just doesn't work like that.
No, it's not magic. It's not going to happen overnight. It's a process. It's a lifestyle change.
And absolutely, it's a lifestyle change. You have to make, you have to continue making healthy choices, healthy food choices. Right. You're going to need lots of exercise in your life.
Right.
I don't care who you are, you need exercise in your life, whether you're overweight or skinny fat.
Skinny fat. Yes,
skinny
that's
fat.
a thing.
Skinny fat is a real thing.
It is.
And then also, it's surgery is a commitment to eat healthy and live an active lifestyle.
Right, and I made a commitment to eat healthy and live an active lifestyle. I had surgery almost 6 years ago, been maintaining for over 4.5 years. Don't ever want to go back to where I was. So I have made a commitment to my health, and it's going to be for the rest of my life.
Yeah, and then sometimes we may also, some of us may need some counseling or support groups or something like that along the way. Right. Is there anything like that you've needed in your life as part of?
Yes, actually. I was in counseling before I had surgery, during surgery, after surgery. So it was very helpful to me. I know, if you have access to counseling, it's awesome. Some people don't. You can join a support group like Overeaters Anonymous. And I want to say that those don't have any fee to it. You can do an online group.
Yeah, is an online group like Noom or something?
No, that you have to pay for that.
Oh, it's not
Noom,
free.
Yeah, you have to pay for that.
Oh, okay.
But Overeaters Anonymous is an actual group that does, in-person meetings. I think they might do some Zoom meetings, but check it out. And, if you don't have access to, regular counseling near you, or maybe your insurance doesn't cover it, it's very beneficial.
Yeah, sounds good. Yeah. Okay, and then so it's definitely not the easy way out. Would you say you felt like you took the easy way out?
No, and I was told I took the easy way out by several people, and it's definitely not easy. I was be the first to admit that today. Maintenance, it's not easy.
It's not easy. I absolutely agree with that.
But it's worth it.
Yeah, for sure. It's definitely worth it. And so moving on to myth number 2. Sarita, what is myth number 2?
Bariatric surgery alone will make me lose weight long term.
False news.
Right.
Also false news.
So on the average, when you have surgery, you can lose 60 to 75% of the excess fat. So say you need to lose 100 pounds. On average, you would lose 60 to 75 pounds, just using that as an example.
Yeah, and of course the different surgeries produce different weight loss results.
Right, that's the average.
Right, and VSG kind of being on the front side of that, and DS being kind of on the higher end of that, with the bypasses in between. And people too. So what is excess fat, Sarita? How do I know what excess fat is? That is like all my weight, like my total weight, maybe 60% of that?
So say weigh 250, but your healthy BMI is 150.
Okay.
So the 100 pounds would be your excess fat.
Got it. So
that's why I just use that as an example.
And that was a perfect example, I think. Perfect example.
Yeah. Sometimes you lose more.
Yeah.
Sometimes you lose all of your excess fat, like I did. It was a lot of hard work, though.
Yay. Yeah. I'm so proud of you.
Thank you.
She's my role model.
Oh.
She's my role model.
Thank you.
Yes. She's rocking this maintenance thing.
I try.
So also, again, the maintenance thing, we're going back to maintenance, talking about long term.
Right.
You can potentially gain your weight back. So you do have to continue using your tool through maintenance phases. And what is a maintenance phase?
So maintenance phase for me is you hit your goal weight and then you're just maintaining.
So essentially the rest of your life.
Yeah. I mean, you may go up a couple pounds, go down a couple pounds. I mean, you just kind of fluctuate, a few pounds, but you're consistent.
Right. And it is lifelong. It is lifelong. And so again, using your tool, like we said before, exercise, stay active. You can't become sedentary. You have to remain active. Again, choosing healthy food choices. Sarita always says, I get my protein in first. I have to get my protein in first.
I still do that. I still basically follow the guidelines because I don't ever want to go back to where I was. Right. And my health is number one. I'll be 59 next month.
That's not, I don't.
And it's true. And my health is number one. It's my priority. So I have to do what I need to do to stay healthy, and that's what I do.
Right, and then of course, staying hydrated, that is important. Lifelong, I know we promote a lot of hydration in the beginning, both pre and post-op phases, but staying hydrated long term is important. And also, when you're working on staying hydrated, choose sugar-free hydration. Avoid calorie-packed drinks, because the number one cause of regain is
drinking your calories.
It's that high calorie.
It's too easy to do, and you will gain weight back.
Getting back into sodas, even juice. Like people are of the mindset that juice is healthy and it's loaded with sugar.
I mean, in the beginning, juice was okay in phase one when clear liquids diluted just to keep you hydrated, but for a lifelong thing, no.
Right. You just gotta wean off that pretty quickly, and then try to stay away from a lot of calories in your liquids.
Right. And if you don't remain committed to this journey, you can, gain the weight that you lost. Yeah, surgery, you can gain it back.
Absolutely. Surgery might help change a person's metabolism to lose that weight, but it is absolutely possible to gain weight back over time if you don't focus harder on that maintenance.
We have seen it.
Absolutely.
All the time.
Absolutely. And then so moving on, because it is for a fact that bariatric surgery alone will make you lose weight long term. That is just not true. So moving on, myth number 3 is
bariatric surgery is a cosmetic surgical procedure.
Oh, false news. This is absolutely not a tummy tuck.
No.
I mean, I guess we are tucking and nipping at your stomach, but not your tummy.
Right.
We're not trimming your fat.
Right.
Well,
your appearance may change, but it's not cosmetic surgery.
No, absolutely, it's not cosmetics. But cosmetic surgery doesn't treat medical conditions, and so bariatric surgery is a tool for treating medical conditions such as high blood pressure, hypertension, sleep apnea, diabetes. And so many other medical conditions, pre-diabetic, people with, like insulin resistance, anything like that. So it is definitely false news. Bariatric surgery is absolutely not a cosmetic procedure, even though you may want a cosmetic procedure post-bariatric surgery.
Right.
Wait 18 months to a year.
Right. And if you do have cosmetic surgery, they want you to be in a maintenance phase for, so long before they do it. So
yeah, most surgeons require you wait 18 months to 2 years. Yeah. So, but bariatric surgery is not cosmetic surgery.
It is not.
And so, myth number 4.
Patients must weigh over 300 pounds to qualify for bariatric surgery.
False news.
So, bariatric surgery is about overall health.
It is.
It's for the moderately obese to the morbidly obese.
And too morbidly.
And your BMI can range, from 28 to 100.
Yeah, we have had patients whose BMI is as low as 28. Actually, some may be slightly lower. Dr. Osuna may take some patients whose BMI is a little lower if they had chronic health conditions that bariatric surgery would treat. And then Dr. Rodriguez has done surgery for patients with BMIs as high as 100.
Right.
Or
kind of like my 600-pound life. I mean, they have very high BMIs.
They do, and there's like a story about that.
There is a story.
There's a story about that. I don't remember the whole story.
I remember reading the story on our website.
There is a good story. Maybe we can add that link in the description here. But again, like myth 3, bariatric surgery does help treat or improve health conditions. It's people who have bariatric surgery are known to no longer have those things like diabetes or.
Well, they don't. Diabetes doesn't necessarily go away. It goes into remission. But a lot of people, lose weight and they can come off their medication because their HbA1c is, into the normal range, but it doesn't go away. It's in remission.
Yeah, absolutely.
But still, one less medication you have to take.
Yeah, for sure. I know somebody many people actually, who had diabetes. Maybe they took insulin or metformin or something like that, and then post-surgery, they don't take anything at all for it.
Right.
And so their doctor would say that their diabetes would be in remission now.
Right.
And so many other things. Somebody that I went with to have surgery on my second trip to NBC, when we went, we carried like this medicine bag, like I don't even know, like 20 medicines. It was so many. It was a lot. It was like a whole little thing of medicine. And post surgery, they come off of all that medicine. They didn't need any of that. All but maybe 3 or 4.
So awesome.
But it was like up in the teens.
Right.
It was a lot.
So another thing, about having surgery, it is not required to lose weight for surgery. We have you on pre-op diet to shrink your liver. Losing weight is not a requirement like it most likely is in the United States.
Yeah, so some people who are upwards of the 300 pounds, they feel like they have to lose a certain amount of weight, or they think that we have a weight requirement that they have to lose, and that's not what our surgeons require. No. Our surgeons just require that you shrink your liver.
Right.
But also that, going back to, is it only for people over 300 pounds? No, it's absolutely not.
We've had people that weigh twice as much as that.
There are people going into surgery that weigh what I weigh now, and I've lost 210 pounds.
I weighed what you weigh now when I had surgery.
See?
Right.
So it's definitely not for only patients who weigh over 300 pounds at all.
Right.
Absolutely. And that you were one of those people. You wouldn't weigh 300 pounds.
No, I did not weigh 300 pounds.
So definitely not. And then for myth number 5, Sarita.
There is a long recovery time after surgery.
False news. Definitely false news on that.
Right.
I mean, well, let's say define long. I guess if you're impatient and you can't handle a couple weeks, maybe it is a long time.
In the U.S., it's usually outpatient. You have surgery and go home that same day.
Yeah, and for the most part, bariatric surgeries are minimally invasive.
Right.
I mean, don't get me wrong; they are major surgeries.
Right.
Especially if you get into the bypass or the DS, but sleeve especially is minimally invasive. Listen, I've had people tell me that the gallbladder surgery was worse than bariatric surgery. All right, so moving on, myth number 5, Sarita.
There is a long recovery time after the surgery.
Also false news, but okay, wait a minute. If you're impatient and a couple of weeks is like a big deal to you, then maybe it does seem like a long time. But let's be honest, it's mostly minimally invasive, right?
I mean, for me, I had a hysterectomy, and that took me a year to recover.
Oh,
totally a year.
Oh,
and so this was like 2 weeks.
Not a big deal.
I was, sore and tender, but no overall pain. I didn't even take the pain medication.
Yeah, so I mean, listen, I'm not going to discount it. It is a major surgery, but it is minimally invasive as well. It's not. There's not a lot of pain associated with it.
No.
When I had surgery and I woke up, I felt like I had an intense ab workout.
Right.
There wasn't that much to it to me.
Not.
And honestly, with both of my surgeries, that's kind of how it was. It wasn't painful. There's not a lot of pain. Of course, we all have different levels of pain.
We do.
I feel like I'm a baby about pain, but maybe I'm not, and I just think I am. But I didn't feel a lot of pain with it.
Me either.
And people tell me that with the gallbladder that's worse. A worse surgery, like you said, with the hysterectomy is worse. A cesarean, people go through cesareans. Like if you can do that, you can definitely do the surgery. Even just giving birth. Like
I gave birth.
I gave birth.
We both give birth.
With no drugs.
I did not have an epidural.
Yes.
So we know what that's like too.
Yes.
So I would say this was a piece of cake.
This was definitely a walk in the park.
Right.
Definitely a walk in the park. And so in terms of long-time recovery, I mean, there are phases, but you want to follow those post-op phases, but you can be in phase 4, which is kind of, well, I guess maintenance is the last phase, but that phase 4 is the last phase of like those post-op phases. And you can be in phase 4 as early as 3 weeks.
Right.
3 to 4 for sure.
Right.
But we do recommend that you give yourself 2 weeks of rest. We just recommend that just to kind of get used to things, right?
Right. I mean, it's a whole different lifestyle.
Yeah, just get used to life again.
Get through the hydration and the protein, and then you graduate to solids and or soft solids and then solids, and then everybody starts to feel better. You're taking vitamins.
You're getting into more nutrients.
Right.
That first week.
Getting your energy back.
You are. And so we do have people who return to work. We have people who come for surgery on Thursday for pre-op, surgery on Friday. They recover on Saturday. They go home on Sunday, and then they're back at work on Monday with desk jobs, of course. And that's fine if that's what you want to do. And the thing is, just make sure you're getting in your hydration. Make sure you are. I tell people who are going to go back to work to drink protein water, add some Pure protein to their clear liquids, so that they're just getting in that extra nutrient since they're exerting their brain, essentially.
Sitting at a desk, you still have to use
think.
some energy, right?
Right. So and just sip, and I'm notorious for getting busy and forgetting to drink. So I always remind people, if you're working, just make yourself a drink. Just don't forgo that. And so you can return to work as early as, let's talk about what long recovery may or may not be. So it is pretty short recovery. Desk jobs, you can return
1 to 2 weeks.
Yep. And
if you have a standing walking job, 2 weeks.
Yeah. Fast pace would be 2 to 4.
Right. If you lifting, if you have a very physical job, 4 to 8 weeks.
Yeah. And some, like we said, some people, they go back. It just depends on how you feel, really.
Right.
Just don't lift over.
Yeah, everybody heals differently.
Everybody does heal differently. I mean, I was walking around TJ for, I don't even know how much I walked around TJ to Tijuana post DS surgery. Like, I walked all over the place. I'm actually truly blown away at how much I walked all over TJ. I mean, strolled. I wasn't like strenuous walking. It's not like I was power walking around.
Right.
But just strolling the streets, checking out the shops.
I wish I would have done that.
Yeah, we went to one of the restaurants. Of course, I didn't eat. Post surgery, you don't really want to eat. But the people I was with, they ate, and we went over to the beach and walked the boardwalk. We walked so much all over the place. Walking
is essential.
It is essential.
You need to walk at least for the first 8 weeks. No strenuous activity until after 8 weeks.
Yeah,
you need to fully heal.
Just get that walking in.
Right.
Get that walking in. But in terms of it being a long recovery, it's not. It's really not. You're back to you fairly quickly for most people. I mean, we don't all fit in a box, so For some people, it may be a little bit different. But then let's say, what is myth number 6?
You can't have bariatric surgery if you have diabetes.
Also false news.
Big false news.
Big false news. We did cover some of this a few minutes ago, but I feel like diabetes and the misconception about diabetes is worth definitely covering one more time.
Right, and that was the reason I had surgery. I was pre-diabetic.
Yes.
And I did not want to be a full-blown diabetic, so I had surgery.
And that was what kind of made you go, hey, whoa.
Yeah, that was my wake-up call, actually, to taking charge of my health.
Yeah, and so again, surgery, that is a major misconception because surgery can improve, reduce, and put into remission diabetes, like we mentioned before.
Right. That's absolutely true.
As a matter of fact, one of the primary treatments for patients with diabetes, suffering from type 2 diabetes, is bariatric surgery.
Right.
So, like we were saying, sometimes if you have a lower BMI and you have certain health conditions, that may be one of the things that gets you approved for surgery. Even.
Right. They would call that a comorbidity.
Yeah. Right. I can never say that word.
Comorbidity.
It'll come out right.
I read about it a lot on the different groups.
I see the word and I attempt to say it often, but I just feel like I don't say it right.
Comorbidity.
I'm not going to say it right now.
So after, if you do have diabetes, it improves, reduces, goes into remission, you have to maintain healthy food choices.
Yes. Or your diabetes could come back.
It could come back. Absolutely could come back.
Yes.
It could come right out of remission.
Right back out of remission. Right. Absolutely. And so, myth number 7.
The hospital stay is weeks long after bariatric surgery.
Oh, false news. False news. False news.
So there's several procedures and they all have different time frames.
Mm-hmm.
So if you are, going to have the balloon, it's a 3-day process.
Yep. So with the balloon, you go in for pre-op procedure and you're released the next day.
Right.
To go home.
If you are having the gastric sleeve, that is a 4-day process.
Yes. And that would look something like pre-op day 1, surgery day 2, recovery day 3, and discharge to go home on day 4.
If you are having a bypass or a revision DS,
right? DS revision or a sleeve to bypass revision.
Or a bypass or any type of revision, right?
Yeah. That is a 5-day process, and that would look just like the VSG process. So day 1 surgery, day 1 pre-op, day 2 surgery, day 3 and 4 are recovery days at the hospital, and day 5 would be your discharge day home. Right. And so, in a lot of places in the U.S., it is an outpatient surgery. Right. They send you home
that day.
Like surgery.
Personally, I feel safer like spending the night in the hospital for a day or 2 just in case. So, I mean, I was happy with that. I did not have an issue with that.
Well, yeah, and with Mexico Bariatric Center, you've traveled all the way to Mexico. We're not going to send you home immediately after surgery, but we
stick you on a plane.
Yeah, stick you on a plane when you wake up from surgery.
Right.
Still kind of loopy.
Right.
Could you just imagine?
No, I couldn't imagine.
Can you imagine where you might end up?
Might end up in another state.
Country?
Yeah.
I don't know. That sounds like an adventure.
Yeah, it could be.
Okay, back to seriousness. But we do keep you a couple of days depending on the surgery that you have, just to kind of get you through.
Right.
Make sure everything's good. Make sure you're recovered from the anesthesia. You always do a leak test the day after surgery.
Yes, you do, and it's yummy.
Is it now?
No,
she's telling a story.
It's awful, but it's a necessity. You're able to drink this fluid,
totally worth it,
and you can see it go down into your stomach
and swirl around in your new tiny tummy.
Yeah.
And you just literally watch it go down.
Yeah, and they send you home with a CD of your leak test, so it's kind of cool.
It is kind of cool. You can show it to doctors later or whatever. We actually, while we're talking about that, I did want to just kind of plug into that our surgeons do 3 leak tests. A lot of places only do 1.
Right.
Even in the U.S., a lot of places only do one. They do the one on the table.
Right.
But our surgeons do 3. They do 2 while you're still in surgery, and then they do another one the following day after you've had time to kind of.
So that makes me feel better too.
Yeah, of course. That's part of taking care of our patients before we send them home.
Right.
Yeah. Mm-hmm. So you're just gonna have to kind of do some digging if you hear some of these things, because
do your research.
There are a lot of myths out there. We definitely did not cover all of them.
No.
By no means at all. But
we hope that we helped dispel some of the myths.
Dispel. That's a good word.
Thank you.
Thank you for help on that.
You're welcome.
Totally.
Yeah.
Yes. So we have really enjoyed this podcast, and we hope that you have too.
Yes.
We will be talking about lots more topics on all things bariatric coming up. We don't know what exactly. No, we're not going to say that. No. Okay.
See you on the next podcast.
Bye.
Bye.
Bye. Thanks for joining us. If you have any questions or want to share your bariatric weight loss journey, you can call or text us at 480-999-4826 or send an email to podcast@mexicobariatriccenter.com. You can also follow Mexico Bariatric Center on Facebook, Instagram, and Twitter. Keep in mind, these are the opinions of the host. The views represented do not reflect or define the values of Mexico Bariatric Center. This podcast is sponsored by Emerge Bariatrics and Mexico Bariatric Center. Please visit mexicobariatriccenter.com for more information.